NBC5 News at 6 starts now.
Only on NBC5 News tonight, we're continuing our three-part series about something we've heard a lot about in the last 6 months, drug diversion. Good evening. Thanks for choosing NBC5 News at 6. I'm Jenna King. Andrea Boyd will join us in about a half an hour. Last night, Dr. Robin Miller kicked off our exclusive series by explaining what it is, where it's occurring, and what we all should be aware of to help prevent it in the future. Well, tonight, Dr. Miller explains just how widespread the problem really is. That's our top story tonight at 6.
Hello, I'm Dr. Robin Miller. Diversion of controlled drugs in healthcare systems is widespread. It's estimated that 10% of healthcare workers abuse drugs and/or alcohol. It's unclear how many divert them. By healthcare workers, I'm talking about doctors, nurses, respiratory therapists, medical assistants, pharmacists, basically anyone who's involved in healthcare. There are many examples of diversion around the country. At Yale Fertility Center and Yale Reproductive Endocrinology and Infertility Clinic, 75 women claim they underwent painful fertility procedures and were not medicated when a nurse stole their medication and swapped it for vials of saline. Their complaints were ignored. The lawsuits and payouts are ongoing. In Illinois, 9 medical surgical patients developed bacterial infections after receiving morphine from a patient-controlled analgesia pump. One nurse started the pump cartridges for all 9 of them. It was hypothesized that she either substituted contaminated water for the morphine or used contaminated needles or syringes to extract the drug. In Minnesota, a bacterial infection developed in 25 surgical patients over a period of a year and a half. The blood infections and the discovery of 2 bags of contaminated hydromorphone led investigators to a nurse who admitted tampering with the bags from locked narcotic boxes. The nurse admitted to peeling back the foil covering of the ports on the bags and withdrawing narcotics with a syringe. The nurse replaced the narcotics with contaminated saline. These are just 3 examples. The scope of the problem is unclear. Just looking at the Veterans Administration, 1,200 of their facilities reported 272 episodes of diversion in 2009, but episodes of diversion jumped to 2926 in 2015. John Burke, president of the International Health Facility Diversion Association, has extrapolated data from facilities in Ohio. He estimates that at any point in time, there are 37,000 drug diverters each year nationwide. The consequences are huge and range from lack of pain relief to infection, patient harm, and even death. We know there's a problem. Where do we go from here?
Dr. Robin Miller reporting tomorrow night on NBC5 News at 6. We'll wrap up our exclusive series by looking at how diversion can be prevented.